Dear colleagues, partners, health professionals, and friends, it's a pleasure to greet you at the launch of the Health Systems for Early Child Development initiative, which will contribute to better health care for young children and families across Europe and Central Asia. Driven by our commitment to support every child to develop their full potential, UNICEF joined efforts with the World Health Organization's Regional Office for Europe and the International Step-by-Step Association to strengthen health systems and build the capacities of health professionals to better support families for optimal child development. Allow me to thank the European Union for its financial support in developing this initiative. This will target countries in the Western Balkans and benefit the Europe and Central Asia region as a whole. I'd also like to thank the experts who guided the setup of this initiative and the development of its platform.
Dear colleagues, partners and friends, it is a great pleasure to speak to you at the launch of the Health Systems for Young Child Development Initiative. Together with UNICEF and the International Step-by-Step Association, we are committed to support the transformation of health systems to put young children and their caregivers in focus. Working together to improve the health and well-being of young children and their families embodies the vision of European Program of Work, United Action for Better Health, leaving no one behind.
We have so far achieved great progress in reducing young child mortality across the region. We now need to continue working together to make sure that every child can thrive. The early years offer an unparalleled opportunity to support the optimal physical, social, emotional, and cognitive development of all children and build the foundations for lifelong health, well-being, and productivity. To thrive, young children need nurturing care conditions that promote and safeguard their health and nutrition, provide security and safety, as well as opportunities for early learning and responsive caregiving. However, 1 in 5 children in Europe and Central Asia are at risk of not developing to their full potential due to lack of nurturing and stimulating care in the family, poverty or social exclusion, or limited access to essential services. We can change this, and this initiative gives us tools to act on these inequities, starting as early as the next health visit or a health checkup.
Health professionals are uniquely positioned to support and positively influence child development and the quality of caregiving. During the first years of life, our colleagues are in frequent contact with almost every pregnant woman, newborn baby, young child and their family. Health professionals are trusted by families and communities. They deliver essential health care to children through preventive measures, immunization and treating sick children. All these points of contact offer great opportunities to support the holistic development of every child. To make the most of these opportunities, we recently published a pocketbook of primary health care for children and adolescents, which provides doctors, nurses and other health workers with evidence-based recommendations on early childhood development, prevention, promotion and treatment from birth. We are here to support health systems and professionals to apply new evidence on early child development and ensure that healthcare services go beyond the focus of physical health. This extended focus includes monitoring child development and offering support to parents in providing children with nurturing care. This approach goes back to WHO's definition of health, not just the absence of illness, but the state of overall well-being. The new paradigm of healthcare for young children relies on a renewed partnership between health professionals and families. And it requires a broad collaboration in which we all need to come together. WHO, UNICEF, ISSA, governments, and particularly health professionals.
The new dedicated platform, which we are launching today, is our first tool that offers evidence-based resources and knowledge on holistic care for young children and their families, for professionals and policymakers in our region. UNICEF stands committed to continuing its close collaboration with governments and partners to shift current models of healthcare for young children. We invite you to use these resources and share them with your networks. We also call on all of you to act today so that every child in our region is able to thrive.
System change is complex and can only be achieved through clear intention, good planning, and firm commitment. I invite all colleagues shaping health policies in the European region to join in the transformation of health systems so that they respond adequately to the needs of young children and their families. The future of child development starts with healthcare. Please make it count.